Well, the definition, the new definition, the 1998 definition of children with special health care needs, I think was a game changer. It just absolutely was a game changer. It was the first common definition of children with special health care needs that was not disease-specific or condition-specific. Remember, we came from crippled children, defined as orthopedic handicaps, conditions. Then we thought we were progressive and moved on to children with complex medical conditions beyond the orthopedic. And then finally, and this was before the definition, there was a growing awareness in this country that children with special health care needs were really far more than just children with complex medical conditions. And about that time, we were looking at children at risk, and we were looking at the childhood population that was not thriving. And it became very, very apparent that we were focusing on too narrow a group of children for maternal and child health, given the broad mission of maternal and child health and core public health functions, that focusing on just complex medical conditions was really not current, and it wasn't being responsive in the context of Title V. So the fact that it was really the very first common definition of children with special health care needs based on elevated service need instead of complex medical conditions is quite groundbreaking at the time. It brought Title V, I think, certainly at the federal level, and I think at the state level, it really brought Title V to the table. It was very hard going to the table with a list of medical conditions that your program covered. It's just hard to talk to the Department of Education about specific diseases and try to make any impact on policy and coordination and how programs should collaborate. But when you go to the policy table with a broad definition of who these children are and how they impact every system in the state and community, you really have a voice. And I felt that at the federal level, and I think that states felt that at the state and community level as well. Now, that doesn't mean that this definition is without its challenges. It really is. I think it's been difficult for some who have very committed to the structure of other frameworks for definitions. It's been hard to make that transition to something less clear, less specific, less disease-oriented. But I think from a policy perspective and a planning perspective and a Title V perspective and a core public health functions perspective, it's the right thing to do. Title V should be planning for, assessing the needs of a broad population of children with special health care needs or broad population of children. We can never address our prevention and our primary care and our well-being goals and vision unless we look at a prevention, early intervention, life course perspective. So I think this definition fits very, very well with what Title V is, with the mission of Title V and what Title V is supposed to be doing. Now, I'm very comfortable with it. I think there are two things that concern folks, and I hear this over and over again, is the misconception that Title V children with special health care needs programs need to provide direct services to this huge population of kids as defined by the National Survey of Children with Special Health Care Needs and this 1998 definition. That's just not true. States still have the flexibility and the authority to define the eligibility criteria for their program. And that may still be filling gaps. It may still be providing services that aren't provided anywhere else. Remember, Title V is the payer of last resort, not first resort, last resort. And states still have the authority to do that. What we're talking about with this definition, though, is in the needs assessment process and in the coordination process and in the referral process that we have a strategy or we know how a broad population of children with special health care needs are directed to the services that they need. No matter where in the system those services exist, that we have a role in making sure those services exist in education, in childcare, wherever they may be, that we have a role, Title V has a role in identifying those services, coordinating those services, and making sure that families get to those services. In fact, the very vast majority of children with special health care needs are probably receiving no services from the Children with Special Health Care Need program in a state, but they are still within the realm of Title V to perform the core public health functions. So that's one. Who does the state Title V program serve? And that doesn't change because of the definition. It changes only when there's a need in the state to change. But the other, I think, troublesome part for a lot of people is the inclusion of at-risk children in this definition of children with special health care needs. And when we were developing the definition, it was a very sticky point, whether they were going to be included or not be included. And I'll tell you, what made the difference was, again, looking at the mission and the vision and the role of Title V. And not just the Children with Special Health Care Needs program. We're talking about MCH and Title V. And it's clear that Title V has the responsibility to assess the needs of an entire population and to make sure that children get preventive care and early intervention. And so a broad definition like this one really, I think, was forward-thinking in including the at-risk population, although I know it's been very difficult to define that population, and I think that's some of the work left to be done.